Good afternoon. We have the great pleasure to welcome at the Nestlé Health Science booth at ECCO 2025 conference Professor Eytan from Alberta University in Canada to discuss advances in dietary management in Crohn disease. So, Professor Eytan, welcome.
Thank you. Nice to be here.
Yeah. First question, we have seen in the program of this year, ECCO 2025, a lot of studies related to biomarkers to predict responsiveness and or to be indicator of success of therapy. Can you tell us a little bit more and give us some perspective in this?
So this relates to more than just nutritional therapy. I think for any therapy, especially now that we have more options, we try and find the best predictor to tell us which treatment is most suitable for which patient. So in general, as time grows and databases grow, these data are becoming more available. We wish that at one point we'd be able to find all of those at the time of diagnosis to really forecast who will respond to each therapy. I don't think we're quite there yet, but we certainly are improving. Now, these could be clinical factors or biomarkers, which are usually laboratory based. And those can be anything from what we use clinically, calprotectin, CRP, etc. They could be disease features such as location, which seems to be important for some treatments, or they could be more on the experimental side. I have a specific interest in microbiome, and given that the microbiome represents the reality, the environment within the guts, there's a lot of hope that that can serve as a biomarker on its own for predicting treatment response. Especially, I think that's attractive in the case of nutrition, because that's the scene where diet works, and the microbes are very much involved in reacting to the diet and producing the effect that we're looking for, which is improvement of disease resolution and remission.
Thank you. And what about AI? It's also a kind of a trend. We have seen a lot of abstract related to AI. How do you see its values in clinical practice?
So I think that's probably the main theme of this meeting has been AI as something that we have to learn to live with. There's naturally a lot of fear of AI, I think, in the general public. But like any tool, if it's used correctly in a professional way with the right appreciation of the limitations, it does offer a lot of advantages. So I'll give you a couple of examples. In my lab, we're using clinical data, and we have a paper that we'll be submitting soon done by my PhD student trying to apply AI for gathering all the clinical data that we have in a large cohort and to see whether that can predict response to exclusive enteral nutrition. This is based on a large data set where we have those numbers. For CDD, I think our studies are not as big at this point. You need large numbers for that, but that approach is very attractive. And I think if we're able to involve large volume of data and types of data, so for example, the diatomic study will include microbiome, metabolome, proteome data. Putting that all together with AI tools may be able to advance our ability to use that to identify biomarkers to predict which patient would be most responsive to diet therapy alone in combination with other treatments, etc. So there's a lot of hope for that in the future.
Thank you. And my last question will be around your experience as a lead expert in Crohn disease exclusion diet and also a lead expert in developing the ModuLife program. Can you tell us a little bit of news and advances in this area?
So I think an important point to make is that diet, like any other treatment, does require professional levels of training and beyond the initial training, maintaining your knowledge and being updated on how the best way to treat it is. And that's where the ModuLife program has fit in very well in providing that basic treatment, but the ongoing adaptation over time as we learn more and more. And certainly I encourage anyone using biologic, for example, you need to read about it, you need to gather that information to use it correctly. So that's true for the use of CDD or other nutritional therapies. And ModuLife does offer that systematic way of dealing with that. So the feedback that I'm receiving from that is both informal and formal. Speaking to colleagues or speaking to patients who are using it as well, we're certainly seeing that it is having an impact, and it's nice to see the numbers that are growing with the use of that. But there also is some research, for example, out of the Netherlands, really showing the impact of the use of Modulife as a resource. We saw nice work out of Spain also indicating that the support around the dietary therapy and the CDD specifically allows for more than just immediate success of this, but even longer term adaptation and improvement in nutrition quality. So it's together with these educational resources that we feel we can improve the implementation of CDD specifically, but diet therapy in general.
Thank you very much for your time and the moment stay with us and this great conversation. I wish you also a great stay in Berlin. Thank you very much.
Thank you, Jalim.